Hi everybody, Governor Roy Cooper here. While we can't all be in the same room this year for the legislative breakfast on mental health, I'm grateful to be able to speak with you today. More than 2 million North Carolinians battle some form of mental illness, and we know it has been exacerbated during this pandemic. Losing jobs, caretaking for children and parents, isolation from holidays and traditions, all of these take a toll. As governor, I'll continue to push making health care more accessible to all communities so people can seek out the treatment that they need. This includes closing our health care coverage gap, expanding Medicaid, and supporting our students by investing in school nurses and counselors. A person's mental health is just as important as physical health, and often they're tied together. Let's work harder than ever to get people the help that they need. Thanks so much.
This morning.
Great. Good morning.
Good morning. It's almost as if we're drinking orange juice right now at the Friday Center. I can feel it.
Almost.
They are busy giving vaccines out at the Friday Center today, so that is a good thing.
Let's see. I think you can go ahead and get started.
All right. Terrific.
Dr. Cohen, I introduced you, and now you're ready to go.
I'm ready to go. Oh, sorry. I apologize, Senator Woodard.
You missed my great introduction. Come on. Let's go.
Thank you so much, and sorry to pop in. So good morning, everyone. Wonderful to be with you. Thank you, Senator Woodard, particularly for your leadership in the General Assembly with many of our other General Assembly partners on really being a champion for those with mental health and IDD needs year over year. You're just such a consistent champion for them, and it is incredible to have that leadership in the General Assembly. Before I dive into the state of mental health for North Carolina, and it's been a tough year for everyone. Just a note on where we are with COVID and this year. I think our state has done incredible work despite the huge challenges that we have faced over this year. The pandemic just being one of them. I think the pandemic was one, really wrestling with hard issues of racial injustice this year. I think our state has pulled together and strength and resilience over and over and over again. But I know it has been incredibly hard. If you look at the numbers in terms of COVID cases and COVID deaths, and you look at our cohort here in the Southeast, the numbers speak for themselves in terms of the work we have done here in the state. And I see that work happening yet again as we enter this new phase of pandemic response with vaccines. Now, we got off to a little bit of a slow start here, but our vaccine providers roared back and showed that they have pulled together as a state. And earlier this week, we shared that we had used 99% of all first doses of vaccine that came into our state before we got that next shipment from the federal government. And it demonstrated loud and clear that North Carolina is strong, that we are ready to take on this pandemic response, and we are certainly ready to take on more vaccine for the folks here. But the sad reality of where we are with vaccine is the supply is incredibly limited. We knew that, but the numbers now speak for themselves. We are getting first doses in incredibly quickly, and that is our expectation of our vaccine providers, is to move quickly and to move equitably as they do it. But the reality is we just have very little vaccine. And I know that's incredibly frustrating and adds yet another level of anxiety and frustration to an already anxious and frustrated and tough year for folks. So we are going to have limited supply of vaccine for quite some time. We are still prioritizing those who are 65 and older. I know that those who have a lot of other needs are waiting for vaccine, and I wish we could get vaccine to everyone right away. But we know that it's going to take us a number of months to get to everyone that I know needs a vaccine, that wants a vaccine. So be patient with us, which I know is so so hard after this whole year, and that we want to get back to being pre-pandemic, having orange juice breakfasts together in person, but we will get there. So please do have patience with us. And I just, again, thank you to all the vaccine providers. As I was mentioning, the Friday Center is right now delivering vaccines while we are holding this virtual session. So that is great. But let's talk about the state of mental health and how we at the department have continued to keep our eye focused on needing to make sure that there was mental health access, particularly at this time of crisis. You're going to hear from my Deputy Secretary, Cody Kinsley, who is just incredible. I cannot tell you how lucky we are as a state that Cody Kinsley came back to his home state of North Carolina, Wilmington raised, worked in DC, but came back and he has been such an asset, not just in running the mental health IDD work, our facilities work, but has taken on the operational role in our response to COVID. He's just incredibly talented, but in taking on that role, he has never had his eye leave the ball on making sure that we were making sure that we were getting resources to those with mental health, behavioral health, IDD needs. And in fact, more than $100 million of federal dollars from the Coronavirus Relief Fund went into those efforts. And his team, and you're going to hear from Victor Armstrong as well, who all did an incredible job making sure that we can continue to provide services. I know he's going to talk about the multiple hotlines that we had, not just for the general public, 24-hour Hope for NC helpline that was out there, but additional resources to make sure folks could connect with telehealth visits and get the access that they need. But also we thought specifically about our healthcare workers and the kinds of strain they would be under this year, and set up a separate help hotline for them to get the support they need. This has been a really tough year. And so Cody Kinsley, Victor Armstrong, the entire team, Dr. Carrie Brown, incredible leaders. We are so lucky in North Carolina. But look, this is a crisis. And these are challenged. The mental health system was challenged well before COVID. You all know it. It's why we get together every year to make sure we're keeping focus on that topic. But we are so lucky in North Carolina. And I saw that yet again when the governor convened a coverage council starting this past November. He convened a council to say, look, we have to get more access to care across the board for folks in North Carolina. We still have 1 million folks in our state who are uninsured. We can do better. There are tools out there. And I hear from everyone that we want to do better. Now, everyone has different approaches to that. I've obviously been very clear that I think Medicaid expansion is the right avenue to expand coverage, because we can get in full federal support for that program, and you get comprehensive coverage. And I'm going to continue to advocate for that. And I know there are many friends and colleagues on here who continue to talk through it. But what I was heartened by with that coverage council, because it was a group of bipartisan leaders, business leaders, small and large, advocates, mental health advocates, physician leaders. What I kept hearing over and over was a shared articulation of us needing to close the coverage gap, number one, but also a real commitment to thinking about mental health and making sure that that was very much a part of what we were doing as we think about access to care going forward. I heard that from every corner of that council that was representing so many. And so I know there are many types of solutions that we need. And as we all know, an insurance card does not mean that you get access to mental health care. We know it. And so one size does not fit all here. One solution does not fit all our problems here. I think Medicaid expansion is incredibly necessary, more than ever, to respond to COVID and the crisis we're in. But it is not the only solution that we need. And we also need to be thinking about the core infrastructure of our mental health system, because we know from other disasters that the long tail on our mental health, that strain that we are seeing is just starting. And that is hard and sad to think about. We've seen it in other downturns of the economy, hurricanes. We know there's an intense period during the crisis where there's certainly strain, but we know this is going to be a long, multi-year effort. And we already know we have a strained and under-resourced system. So we have a lot of work ahead of us. Again, I think Medicaid expansion is going to be that tool that we need to help us, but it's not the only tool. And so we have a lot of work to do. I know Cody is going to outline a lot of what we're thinking about in terms of ongoing investment. One of those pieces is, as we are thinking about our Medicaid transformation. Remember that when that was our top issue that we were talking about before COVID hit, but we have not let up on that. And the General Assembly has definitely said, go forward on Medicaid transformation, and our team has been doing that. And I think more importantly than ever, we need to think about that whole person care. We've been talking about it. This is now 4 years I've been here in North Carolina. We've been talking about whole person care, physical health, mental health, and all of the social drivers of health. And I think COVID showed us how important it is to keep focusing on that whole person well-being as we move forward. So that is what our team is going to stay focused on. I'm so grateful for the partnership as we go forward in this hard work. And it's going to be hard, right? When you strain a system with crisis, it is going to be challenging, and we're not going to be able to meet all of the demands. We're going to need to put resources and talent and creative thinking towards that as we go. Again, I think that one of the things that will help us get there is Medicaid expansion, where we can get folks covered with no investment of state dollars. And then we can use those state dollars for all of the other things we know we absolutely need to continue to improve access, recruit behavioral health providers, make sure that we have that infrastructure here for folks. So with that, I am sorry that I jumped in. I apologize. I thought I was at 9:30 and I thought I was joining early. I guess I didn't. So I apologize for that. So thank you so much. I see so many friends and colleagues who are on this that are working so hard. What a year. I have no words. I'm out of words. But thank you so much for all that you have been doing to make sure that communities across North Carolina have the kind of care that they need in this incredibly hard time. We're going to work together to make sure it's even better as we go forward. So thank you so much. Thank you, Jenny. Thank you, Senator Woodard. I see Senator Bergen up there, and I'm going to turn it back over to you. And also my last thanks to Cody Kinsley for all of his incredible leadership. So be kind to him because he's been working so hard. He needs a vacation. All right, back to all of you.